My name is Dr. Nazia Saad Khamis Abdullah, and I'm with Dr. Halima Fathi Muhammad Al-Abdali. Both of us, we are from Libya. We are Group 5 from the Affirmative Team, and the topic is about should African government penalize hospitals and clinics that fail to adopt genomic testing protocols for antibiotic stewardship programs. Next. AMR is a growing global health crisis, and Africa is facing particularly severe challenges because of the limited healthcare infrastructures, overuse of antibiotic, and rapid spread of resistant pathogens. Genomic testing is a powerful tool for antibiotic stewardship, enabling for precise identification of bacteria-resistant pattern and also guiding to a targeted treatment. Next slide. Next. Today we address a critical question in global health. Should African government penalize hospitals and clinics that fail to adopt genomic testing for antibiotic stewardship? Because it's a silent pandemic and Africa bears a disproportionate burden, and genomic testing is a powerful tool and it's a good way to combat this crisis. Its adoption remains slow and uneven in between the African countries. So should government enforce compliance through penalties, or would this approach do more harm than good? Next. One of the constructive arguments is that the urgency of the AMR crisis, because it's one of the leading causes of infection-related death worldwide, exceeding the annual death of TB, malaria, and HIV, and it's responsible for the death of 10 million people per year worldwide, and exerting a total global cost of about $100 trillion. AMR, it affects all the nations, and discovering a new antibiotic with novel mechanism of action, it's becoming more difficult year after year. Next. The accountability for public health impact. If there's facilities and there's ignorance for the available of the genomic tool, it may contribute to ineffective treatment and resistant strain and increase the mortality. So justifying government penalties. The economic implication of antibiotic resistance, they are substantial and extend far beyond the direct cost of antibiotic treatments. Next.
Hello everyone, I'm Dr. Halima Al-Abdali. I'm in Affirmative group with Dr. Nazia Saad Khamis. We are graduated in the Pan-African BGS Education and Research Initiative. And the third constructive argument today about our topic, we're talking about the driving system. The penalties create incentives for health institutions to help modern diagnostic tools and align with global health best practices. According to the WHO in 2010, which talking about the accountability and efficiency of the health service are well managed as so to achieve the co-element with minimum wastage of resources. Managers are allocated the necessary authorities to achieve planned objective and held accountable for overall performance and results. Next. The fourth point of the constructive argument about the cost effectiveness in the long run. While genomic testing may be costly upfront, it reduces the unnecessary prescription and hospitalization, saving health system money long term. According to the Frontiers in Antibiotic 2022, which said the effective surveillance and preventive activities that are consequence of positive genetic test result will ideally reduce the treatment cost for AMR. Next. Strengthening data and surveillance infrastructure. Penalizing non-adoption promotes better data collection, enabling countries to build real-time genomic AMR surveillance system. So, each low-income country should develop its own organizational structure and define terms of reference. While the governance structure may vary, important factors include identification of national coordinating centers, convening a technical team, a strong engagement with Ministry of Health, reflecting the national importance of AMR surveillance in health system. Next. Now we are going to the rebuttal section, the claim which another team, the negative team, which said it's a valuable tool but not yet visible as routine hospital practice. Also, they said most African hospitals lack diagnostic capacity. Also, 1% of facilities capable of basic bacteriology. And also, they said it's require massive funding, advanced lab, and specialized staff. But in contrast, we found in the Africa, there is a lot of hospitals, private and public hospitals, especially in South Africa, which advocate the genetic testing and also the genetic research. These hospitals in South Africa have demonstrated capabilities in genetic testing, backed by specialized staff and funding from the various sources, such as the Rice Duck Foundation, World Bank, and also NRF. These hospitals and clinics, it contains specialized staff, such as professors and researchers. Next. The negative team, they are said the stewardship worldwide still relies in prescribing guideline and surveillance, and it's mainly used for surveillance and not everyday care. But in contrast, we found the AMR affect humans, animals, and also the environment. If you don't take action now to resist the resistance, about 4 million people across Africa could be dead by 2050. According to the WHO Africa region, that estimated about 1.5 million deaths associated with bacterial AMR. Also, the use of genetic testing in AMR is gaining traction worldwide. Researchers and healthcare professionals advocate for integrating the genetic testing into ASPS to enhance treatment outcomes and combat AMR. Genetic surveillance becoming a part of national AMR surveillance system in Africa at this time. Countries should optimize the quality and representativeness of phenotyping surveillance and leverage the expansion in genomic capacity to advance genomic AMR surveillance in Africa. Next. The negative team, they are said less than a third of African countries conduct routine AMR surveillance. Without this foundation genomic test, it's unrealistic. But in contrast, we found a lot of African institutions that support the genetic testing and genomic testing also and genetic research, such as the Africa CDC institutions. These institutions that enhance the aims to enhance disease surveillance and public health partnership. The other institutions, such as African bioinformatic institutions. Next. The negative team or negative group that they are said in many African countries, healthcare is paid out of pocket, such as Nigeria and Kenya, and also the antibiotic widely sold over the counter across Africa, and hospitals cannot control the majority of antibiotic use. Regarding the WHO Regional Office for Africa supports about 47 member states to track progress in the financial protection in health by building the capacity of ministries of health and the statistical office. Also, the monitoring the antibiotic production and uses in animals, humans, and environments, it's important through the collaboration of agencies involved in the three domains. Next.
Okay, the claim is that the negative team says that punishment creates fear among health workers, and this fear reduces the openness to report the errors or seek guidance. And supportive strategies that will build trust and improve the compliance. Training and mentorship have reduced misuse in African AMS program, and they said the pharmacist alone, it can lead to stewardship program without the help of other members. But we as a team, as a positive team, we found in 2021 alone, there were about 4.7 million deaths associated with the AMR globally, and most of them, unfortunately, they were in Africa. And as of 2024, 45 of 47 countries in the WHO African region, they had developed their national African plans, and 33 they were endorsed by their government. The higher level, okay, facilities, they should be a multidisciplinary teams, not the pharmacist alone. There should be a medical doctor and a pharmacist and a trained nurse and other healthcare workers who are interested in AMS programs. So that's why these AMS focal persons, all of them responsible for implementation of the AMS stewardship and activities. Next. Genomic testing protocols, they are still evolving globally. That's what the negative team said. But we as a team, we see that genomic testing is advancing rapidly worldwide. And they said that most of the African countries, they lack national AMS framework and genomics, penalizing they're not ready for it because of the limited infrastructures. But if we see the highest rates of the over of the country antibiotics, it was about 100% in Zambia, and this is really dangerous because because of the genetic diversity also in Africa, especially in Africa. So that's why the need of the genomic testing, it's very important in between hospitals. Next. Okay, punishment is the best incentive because they said that if we provide the funding and technical support instead of the penalties, it's better. But in some African AMS program, antibiotic misuse persisted despite the training because no consequence existed for violations. And there's external organization, as Dr. Halima mentioned, there's a lot of them. For example, H3 Africa, and there's the 54 gene that's located in Nigeria. All of these, they help in the implementation of the AMS stewardship programs and try to help to implementation of the genomic tool testing. And they said that the negative team said that invest in training and capacity building for health worker, it's better than penalties. But in Nigeria, we see in Nigeria, in the NAFDAC, it has penalized pharmacies for illegal antibiotic sales. So this will prove that deterrence works. Next. Okay, at the end, ladies and gentlemen, the threat of AMR, it's not a distant future. It is here, claiming lives and undermining healthcare system. We must acknowledge the real challenges of funding and infrastructure. Penalties, when paired with smart policies like phased implementation, targeted subside, it can drive the urgent adoption of these life-saving tools. If we act decisively today, we can safeguard antibiotic for future generation, protect vulnerable patients, and position Africa as a leader in the fight against of AMR. Next. And those are our references. And thank you so much.